We have with us Meg, and this is very interesting. Meg is a good friend of mine, someone who is knowledgeable, someone who has all kinds of good things to bring to the table in every single aspect. It's really a pleasure to have Meg. Meg, we spoke before, and I want to ask you a question. The difference between, and you're an expert in this, you've been doing this for many years, certainly have helped many of our clients throughout the country. What is the difference in your mind, from what your professional point of view, the difference between bringing a medical doctor versus a nurse practitioner? Because out there, most people say, you know what, I don't know if I want to bring an MD. How much is that going to cost me? They want 150, 130 bucks an hour. I could get a nurse practitioner for that price. Why would I do that? Tell me what you think are the most important points that you would think we should look at of the difference between an MD or a DO and a nurse practitioner.
Well, absolutely. You can, obtain a nurse practitioner from $45 to $55 an hour. If someone's a strong injector of knees and joints, they're typically going to earn somewhere between $55 and $60. If you're going to bring on, let's say, a physiatrist who is an injector, right, brings the procedures, you're going to be paying $125 to $130 an hour. So it really is deciding where you want your money to go. However, with reimbursements, if you have an NP, you get 15% less billables than you do on an MD or a DO. So my advice with a new practice that wants to be integrated is start off with an NP part-time. Don't, you're sinking a lot of money into your practice to grow it. So just bring in an NP part-time. Then will need a collaborative physician in the states that they do not have total autonomy and authority. And then, whoever is working with you can talk to you about what you'd have to pay the collaborative physician. That would be my advice, and that's what I give.
Quick question regarding the opportunity to bring a nurse practitioner versus a medical doctor. If a physician was to come on board, we could negotiate about the price of their hourly fee or whatever the case may be, the percentages and all of this, and I understand that. However, in many states, as you are well aware, nurse practitioner have to have a collaborative physician, and therefore they have to work with them. What would you say from a financial standpoint, what would you say is the fee we should pay, or what is the usual fair customary rate, a fair market value for the hourly fee or the monthly fee for the collaborative physician?
The real number out there is really anywhere between $1,000 and $1,250. When someone will come to me and say, well, I'm making $3,000 as a collaborative, I'm like, no, you're not. That it's 3 to 5 hours a month, doing 10% chart review, mentoring the NP if they ever need it. But anything over $1,500, $1,600, $1,700, especially in a new practice situation, I think that's a little off the mark. Yeah, and I've seen it. I mean, we did all the collaborative physicians for Walgreens and Walmart, and we do collaborative, throughout the world. Not throughout the world, just throughout the country. We work closely with the collaborative world. So really, $1,000, $1,250 a month is fair and reasonable.
I want to ask you a question. Given the concept that's going on today about this need for more of medicine or access to medicine, especially with this pandemic going on, what would you think? I mean, will there be a need for more nurse practitioners to be acting as gatekeepers in practices as the months go on, or will there be less of a need? What's your thoughts on that with the pandemic?
Well, I've been really surprised at the layoffs of nurse practitioners and MDs and DOs and PAs. I mean, I was really surprised at the practices that either knee-jerked and furloughed or knee-jerked and just let people go right away. It was a little surprising to me. I think moving forward that the areas that will need NPs, MDs, DOs, PAs is going to be musculoskeletal and physical medicine and rehab and psych. I mean, psych goes without saying. but think about the patients, and we're sitting at home, somebody's becoming a weekend warrior. The stress is in someone's, body of going through this. And I really think on the other side, it's going to be the PM&R world that's going to explode.
I definitely agree with that. I want to ask you a question regarding, obviously, there's no crystal ball that anyone has, but you've been a professional for many years and you've been working in this field of medicine. Do you think there will come a time in the near future where the nurse practitioners who have limited amount of knowledge and limited training, I mean, let's face it, their training is just a couple of years compared to a medical doctor, but medicine is medicine. At the end of the day, I remember many of our clients who have claimed to me, the client will come in, will call me and tell me that a patient will walk in and ask them for treatment irrespective of their license. They just know they need a medication or they need certain treatment, and therefore they're expecting the clinic to render that, and many of the doctors would have to clearly state, well, we don't do injections or we don't do this kind of treatment or what have you. Do you think that as the years go by, and today more and more with this pandemic and the money being tighter because of the economy shifting, do you think that the nurse practitioners will become greater part of the gatekeepers and act as family practitioners in more and more practices as we go on?
They already are. They are. It has broken my heart through this, the phone calls I get from really my family practice doctors. As you know, we're very specific in the musculoskeletal world.
Right.
I'm physiatrist and integrated practices. But it has broken my heart that these family practice physicians, thankfully they can be collaboratives and make a little bit of money, but they are being replaced by the nurse practitioner.